Good afternoon, everyone, and thank you for joining in on this latest COVID-19 update. With the continued decline in COVID-19 cases, the governor announced last week a return to Step 2 of Phase 3 of the state's reopening plan, which includes indoor performance venues such as concert halls, theaters, and other indoor performance spaces that can be opened at 50% capacity, and indoor recreational activities with greater potential for contact, like laser tag and roller skating, can also open at 50% capacity. The biggest change is that there are no longer capacity limits on our restaurants. However, social distancing for all tables and 90-minute time limits remain in effect. And just 21 days after this step, the state plans to move forward to Step 1 of Phase 4 on March 22nd. Indoor and outdoor venues will be allowed to have 12% capacity permitted. These venues include concerts, conventions, and wedding venues, as well as sports arenas like Fenway Park, Gillette Stadium, and TD Garden, which have been shuttered to spectators since last spring. Additionally, under Phase 4, gathering limits at event and public settings will be able to have 100 people at indoor gatherings and 150 people at outdoor gatherings. In private settings, including homes, limits will be set at 10 people indoors and 25 people outdoors. This is a good sign and a step in the right direction. These changes would not be happening if the state hadn't seen for almost 2 months now the public health data with positive trends on cases and hospitalizations. However, residents must continue to wear masks to prevent the spread of COVID-19 and are encouraged to avoid outside contact of their immediate households. The travel advisory and other health orders do remain in effect. We must continue to adhere to the CDC guidelines and state guidelines to ensure that we can continue to see more of our local economy and businesses open and expand. We currently have 6 new active cases of COVID-19 in the Newburyport community. In total, there have been 1,103 positive cases in Newburyport since the start of this pandemic. It's hard to believe that it's been a year since all this began. This Monday was the first COVID-19 Memorial Day. Church bells across the city rang for their bells for 33 times to honor the 33 residents lost to COVID-19 and to those who are grieving their loved ones over the last year. We also held a short video memorial service to honor those deceased and to comfort the living. I am so grateful for our interfaith leaders and students who participated and hope they provided a little solace for our victims' friends and families. I would also like to highlight the work of our essential workers who have stepped up to provide critical services to help protect our communities and save lives, risking their own health and safety. Thank you. Yesterday, the state announced that kindergarten through grade 12 educators, child care workers, and school staff will be eligible to schedule COVID-19 appointments starting on March 11th. This group joins the current eligible groups, including 65 plus and individuals with 2 certain comorbidities. There are approximately 400,000 K through 12 educators, child care workers, and K through 12 school staff in Massachusetts. Due to a severely constrained federal supply and the existing population that is currently eligible for vaccines, it is estimated that it could take a month for all eligible individuals to secure a first appointment. This time frame is only subject to change if federal supply increases dramatically, including the recently authorized Johnson & Johnson vaccine. The city has also been working with our EMS provider for a vaccine rollout for educators in Newburyport Public School District, but efforts have been pushed back there also. So it is yet to be determined if this mechanism may also be an option. Last week, Governor Baker, School Commissioner Riley, and Secretary of Education Pizer visited Newburyport. The visit was a welcome recognition of our Clipper community. They visited the Knox School to observe the new pilot COVID-19 surveillance pool testing program, which our schools will be utilizing as a tool to allow us to monitor the spread and prevalence of COVID-19 in our schools. We are thankful to Governor Baker for launching this pilot testing program. It is an important step towards safer in-person learning and to keep our district in a positive position. All of these efforts are focused on fully opening our schools as soon as possible. On Tuesday night, March 9th, a special school committee meeting has been scheduled where Superintendent Gallagher will present the next phases for increasing in-person learning in our school district. The remote link to the meeting is posted on the city website on the public meetings calendar. I hope you'll join us. We are also fortunate to be able to vaccinate our eligible residents and staff of public and private low-income and affordable senior housing. Our public health department will hold a small clinic over the weekend for approximately 200 of these residents. I am also thrilled to announce that our application to the state to have a regional vaccination center was approved yesterday afternoon. The Lower Merrimack Valley Regional Collaboration will include Newburyport, Salisbury, Amesbury, Newbury, West Newbury, Raleigh, Georgetown, Groveland, and Merrimack. We are working on a rollout plan, and the collaborative will be on the state website at mass.gov/COVID map. /COVID vaccine map as of next week. Please be patient as we move this initiative forward. We do know the goal for the clinic is to have the ability to administer 750 doses of the vaccine daily. But this won't happen right away. It will take time to obtain that amount of supply from the state. We will continue to provide communication on this initiative as we proceed. As I advised before, the host agreement we have with Beth Israel Lahey Health with Anna Jakes Hospital included continues at the Senior Community Center. They too will be ramping up as more vaccines become available and anticipate the ability to administer over 2,000 doses per week, but again, as supply becomes available. Please note the site is operated through Beth Israel Lahey Health, and registration is through their system and supports over 100,000 patients in the greater Newburyport area. I would also like to take a minute to talk about the vaccine itself. The state has launched a Trust the Facts, Get the Vax public awareness campaign for the COVID-19 vaccine, and I encourage everyone to go to the mass.gov website to learn more, especially if you have any reservations about getting the vaccine. A few facts to know about the vaccines. Vaccines are safe and are one of the best ways to protect yourself and those around you from getting sick from the COVID-19. The vaccine doesn't contain the virus that causes COVID-19, so it can't make you sick. You may experience mild side effects after getting the vaccine, but this is a sign that your body is learning how to protect you. Vaccines help our immune system fight infections in the future. The COVID-19 will protect you from the virus that causes COVID-19 without getting the illness. The vaccine can help you from keeping COVID-19, but even if you get the virus, it can keep you from getting very, very sick. There are 2 approved COVID-19 vaccines, one from Moderna and one from Pfizer, given in 2 doses, about 3 weeks apart. You need both doses to be fully protected. A third vaccine from Johnson & Johnson has just been approved and requires only a single dose to be protected. It takes a few weeks after the second dose to become fully protected. You may have a sore arm, aches, fatigue, or fever for a few days after getting the vaccine. These symptoms, again, are a sign that your immune system is learning to protect you from the virus. Please go to the mass.gov website to learn more about vaccine safety and the work that has been done. So please, when you become eligible, get the vaccine. Vaccination will allow you and your vaccinated family and friends to return to some semblance of normalcy even sooner. On a business note, local funding is still available to qualified small businesses who have been impacted by COVID-19 by the state's Community Development Small Business Grant Program. We are working with the City of Amesbury to administer the program, and so far, 21 grants have been awarded to Newburyport small businesses. Please visit the City of Amesbury project website page and learn how to apply. The city has also been awarded a local rapid recovery grant, technical assistance for reopening our downtown with Public Planning Research and Implementation, Inc. Our first meeting will be held next week. As you may have heard, at this time, the city will not purchase the surplus state property from the National Guard located at 57 Low Street. The City Council spent approximately 5 months deliberating on whether to purchase the surplus National Guard building and property for general municipal purposes using $220,000 from the city's free cash account. The site was being considered for a much-needed field office for our Parks Department or future youth services. While we're not moving forward with the sale, we will continue to plan to have a site selection committee for youth services to review potential options to relocate them from the Brown School. I know many of our residents were engaged in closely following this process, and we are grateful for your outreach and support. We are awaiting a response from DCAM and the National Guard on their next steps with the site and whether or not we may be able to enter into a formal license agreement and use the site for a temporary field office for parks. The city is also looking forward to finalizing the contract with Sasaki for the design of our central waterfront park and open space, and anticipate a favorable vote from the City Council on Monday night. In closing, with the arrival of vaccines, a lot of us are asking, when will our life return to normal? But it's still a long way off. While we can't know for certain, we are pointed in the direction of herd immunity, which is when enough people are protected from the virus, either from vaccination or a past infection. Many experts say at least 70% of the population needs to be protected to reach herd immunity. Until then, whenever that is, we will continue to wear our masks and practice social distancing. Yes, this will all end one day, but today we have renewed hope. Have a wonderful weekend. Stay safe and stay healthy. Thank you.